Our first guests tonight are here to diagnose whether this country is equipped to deal with the Ebola crisis and what we can expect in the coming days and weeks. Dr. Robert Gary, professor in the Department of Microbiology and Immunology at Tulane University. Dr. Frank Glover, urologist and the president of SHIELD in Africa, an organization working in Liberia, partnering with the medical mission group SIM. Good to have you with us, doctors. Let me begin, if I may, with you, Dr. Gary. The CDC continues to say that this is being stopped in its tracks, yet we have two more cases. Cases in Utah and Hawaii have proved negative, but two cases still under investigation in the nation's capital. What is your view as to whether it can be stopped, quote unquote, in its tracks, as the White House has insisted?
Well, Ebola will be stopped in its tracks in the United States. Our public health officials will get this, all those cases that were exposed to the gentleman in Dallas under surveillance, under control. This virus is not going to spread in the United States like it's spreading in West Africa.
Are you as comfortable, Dr. Glover?
Well, I'm comfortable in some ways. I agree with the statements of Dr. Gary, except that I think that we're not getting a full picture of what's actually happening in West Africa. I've personally made 25 trips to Liberia over the past few years and worked all over the country, and knowing the situation there, there's a gross underrepresentation of the number of cases. I would say there are at least 20,000 cases in Liberia alone right now, and because there's in its exponential growth phase,
in Liberia
alone, which is double the number that's being reported for the three countries combined.
Right.
And I say that because of my knowledge of the place, and since it's in its exponential growth rate, it's going from 10 to 100 to 1,000 to 10,000 and then to 100,000. And so with such a high prevalence of the disease, we have to make the assumption that anyone coming from Liberia potentially has been exposed to the virus. And so when we have workers return from these areas, we put them in a 21-day observation quarantine, and yet we have people that have no medical training or background that come from these parts, and they're allowed to simply vanish into the population. And from a public health standpoint, and I'm a doctor of public health as well, this doesn't make sense.
Dr. Gary, what Dr. Glover is saying is disturbing because we've also heard from other medical professionals who are not as familiar, certainly with Africa, but who are saying precisely that the screening processes are inadequate. We know that United Airlines is giving notice to 400 people who were in proximity to patient zero, but they haven't contacted all of them. There hasn't been communication yet. What do you think about what Dr. Glover said, and why in the world would we not do the intelligent thing, which is simply screen those coming from those countries?
Well, we should do that, but we need technology to do that. Let me say that I need to qualify my first statement. We'll get this outbreak under control in the United States. In Africa, in West Africa, it's certainly not under control. So I'm not quite as assured that the measures that we have currently in place are going to stop this outbreak in its track in West Africa. In fact, I don't think they will. The situation is very dire. The cases are spread all over. We need to have different kind of thinking about how that's going to happen. Yes, it's true. In the past 40 years, we've controlled all these outbreaks, but this outbreak is much different. It's much wider spread, many more cases. We certainly don't have enough resources in the area right now. I don't see the resources getting there anytime soon to bring the outbreak under control in West Africa. We simply can't put a ring around those countries, let all the people die, or become immune.
For God's sake, Doctor, I mean that's ridiculous of you to say.
What?
We can't put a ring around these countries and let people die when we've got people like Dr. Glover working very hard every day of their professional careers and lives to make certain that that does not happen in organizations. This country is spending more effort and energy to do something there than anyone else. I know that you didn't mean to sound glib and thoughtless, but that's precisely the impact of what you said.
No,
and we're talking about this country as well. And what concerns me deeply is how much we know. When Dr. Glover says that we are underestimating the number of cases in Africa, and I know there are two different regions, the United States and West Africa, but the reality is we're not getting a straight story from the CDC or local health authorities either in this country in the case of Dallas. Well, how can we make certain that the American people are getting straight answers from their public health officials and the medical community?
I think they are, but let me qualify what I said then. I mean, what I said is we can't do that. What we need to do is to ensure that healthcare workers can get into those countries to take care of the people in West Africa to shut this outbreak down. And, you know, if we shut off all the airlines and things like that, people can't get in. And so if we can't,
Well,
if
no,
we
wait
do
a minute,
that,
Doctor.
if we
Doctor,
do
wait
that,
a minute, wait a minute,
yeah.
wait a minute.
Yeah.
Forgive me.
No,
What we're
no
talking
problem.
about is screening incoming passengers from those national origins that are dealing with Ebola. That has nothing to do with flights out of this country. And as is the case that Dr. Glover has just raised, and Dr. Glover, I want to turn to you. Why can't we simply do intelligent, protective, sensible things like screen incoming passengers, for crying out loud?
I think, me personally, I think that's the way to go. Right now, we have a few cases, potential cases right now. Next month, we could have 10. The next month, we could have 50. And are we going to have these people just go into the population, present to some health facility, and then have to chase down hundreds and maybe thousands of contacts? We have great resources in this country, but they're not unlimited. And so in Liberia, only 20% of people can even get health care. And so the gentleman that tested positive in Dallas, he in fact had taken this woman to 3 different hospitals, and she was turned away and she died. He realized he was exposed and he didn't want the same fate, and he jumped on a plane and came here. So we're giving an inducement for people to come here. And I'm saying if they come here, they should be observed for a period of time so as to ensure safety of our population here in the United States.